Professor Stacy Callahan, you teach clinical psychology and psychopathology at Jean Jaurès University in Toulouse, France. You're a clinical psychologist and you wrote several articles and books on cognitive behavioral therapies, on motherhood, but also on imposter syndrome. As you know, Trey Publishing House has just translated your book Traiter la dépréciation de soi, le syndrome de l'imposteur, that you co-written with Kevin Chassangre, therapist, teacher, and author of an academic thesis on imposter syndrome. Thank you, Professor Callahan, for being with us.
I am very pleased to be here, and I want to thank you and Trice Publications for inviting me. I'm very honored to be able to talk about this, and I was both surprised and touched and honored again that our book was translated into Romanian.
Mm-hmm. I should also mention that your book, Traiter la dépréciation de soi, targets mainly the mental health professionals, but could also be very useful for a larger public, such as parents, teachers, or human resources specialists. And now here is my first question. As a clinician and as a teacher, as a professor, you met a lot of clients and students. Could you describe us the first person that comes to your mind when you think now about the imposter syndrome diagnosis? How does he or she behave and get along with others?
Well, when I read the question and you've just asked it now, my first response is me. And I think Pauline Clance, when she wrote about the imposter syndrome, she admitted that she herself had felt this. So there's me, but there's also so many different people because as we describe in the book, there are a lot of different aspects to imposter syndrome. There are a lot of different ways that you can kind of gauge if somebody is living, I want to say suffering because you don't always suffer. But if you're living with the imposter syndrome, you can kind of gauge this on a variety of different levels. I gave a quick vignette at the beginning of that book about an imaginary person named Esmeralda, and she was loosely based on a couple of patients that I'd worked with. I've never worked with anybody named Esmeralda, and I've never worked with anybody who had that particular problem as a lawyer, but she englobed all the different things. And in her case, the real defining factor was procrastination. So as a clinical psychologist, I will look at these different aspects, and Kevin and I have put together, this book and other materials to really look at how you can attack either procrastination or perfectionism or difficulty accepting yourself. In her case, I would have really looked to see what was feeding the procrastination. In cognitive behavioral therapy, we look at the sort of reinforcement cycle that patients have put into place, and we look to see how we can stop that. Because when we do things, the theory in CBT is that it reinforces us. It's kind of a reward. It somehow makes us feel good. But usually that's based on something we learned a long time ago. So in Esmeralda's case, she procrastinated, and our brains aren't real good at sorting these sorts of things out, especially when it comes to anxiety and these sorts of things. Probably when she was younger, she made the connection between procrastinating and doing well. So if she does things at the last minute, it gets done. But logically, the frontal cortex comes in and says, well, no, you should have worked all along. And so that kind of destroys this feeling of, I managed to succeed this time. So there's a whole lot of different things going on. But the first thing we'd have to attack for her was, how do you stop procrastinating? Or how do you procrastinate, dare I say it, more effectively? You can procrastinate effectively. You can put off a little bit at a time.
We can continue by describing this imaginary Kate by saying that Esmeralda is in a certain sense a perfectionist. And my questions will be, okay, what will be the difference between perfectionism and imposter syndrome? Because any perfectionist fears that she or he is not good enough as a parent, as a worker, is anxious that she or he will fail.
Right. Absolutely. Perfection is yet another trait of the whole syndrome. And there again, in therapy, we would start attacking that at some point. When we do therapy with people, we look to see what's causing the most trouble at any given point. And when they come in and their initial request, we'll take that and we'll say, that's what we're going to go with. Perfectionism is not my specialty, but it's something that we have to grapple with regularly. When you're dealing with somebody who's perfectionistic, it's because they have very high standards, and this has served them well. For example, a university professor who's had to work very hard, who's had to publish things at a very high level, they're perfectionists. And it worked well for them to get to where they are in a career. It doesn't work well for them when they just have to write a paragraph to on a letter of recommendation for a student. You can't spend 6 days writing something like that. So perfectionism, you have to start looking at these sorts of traits as, what does it give to me? What do I want to keep? And how does it sabotage me? What do I want to get rid of? Can I stop being so perfectionistic? Is it going to be problematic if I'm not as perfectionistic? So you really have to start analyzing what purpose it serves, how it was useful, and how we can kind of channel it. And when I talk with patients, I talk about these sorts of traits as being superpowers. And, just like a superhero, got to use it for good. So use your perfectionism to help you, but don't use it to sabotage you.
In your book, you're talking about several mediums, several environments and contexts that triggers the imposter syndrome. And an important context would be when one becomes a parent, a fresh parent.
Yeah.
As a researcher, you studied the way in which fresh mothers try to cope with their new parental role. And what would this imposter syndrome look like for a fresh mother, for instance?
Well, for new moms, it's specific. So let's take it one step back and say, if we're attempting something, whether it's an academic career, a new job at the office, or being a mother, we have a goal. We have a goal to succeed. We have a goal to do the best that we can and to produce something. And a lot of times the goals we have are goals that we've created in ourselves. I want to be a good manager because I want to be promoted, or in the case of mother, I want to be a good mother because, it's important to do this. But we also have the goal that's coming from society. Okay. There's pressure in the work environment. There's pressure in the academic environment, and there's pressure in society to be a good parent. If you start looking around, I've noticed in most cultures, I'm not sure about Armenian culture, but in most cultures, people can be very quickly judgmental about parents. I remember when my children were little, I had one child who did not like to wear a hat. There was nothing I could do to put a hat on this child, and I would carry her in a baby carrier. And I think I walked out one day and it was a bit cold. She wasn't freezing, but it was a bit cold. And probably the sixth woman who stopped me and said, "Oh, you should really put a hat on your daughter," I just very sarcastically said, "Well, I tried to do it, but when I stapled it on, she pulled it right off." And the woman looked at me with a lot of shock. But people make judgments like that, and that's a tiny judgment. But let's say we have a child who's acting up in a classroom or who's not adapting well to daycare. A lot of times mothers feel like they're being looked at, even if the personnel don't do that. So when you get to the imposter syndrome, you're looking at somebody who's not sure that they can do well. They're not sure that they can perform optimally. And as soon as they have any hint that they aren't performing optimally, they get very stressed and worried. And they start getting into that cycle of depreciating themselves, putting things off that they could be doing, and really accepting themselves. parents do the best that they can in all cases. Some parents come to the situation very unprepared, with very few skills. The way they grew up, the models they had, don't give them the tools they need to be a good parent. So you have to look at that and not say, oh, you're a bad parent. You have to look at it and say, oh, I think you need some new tools. You know, maybe you want to try this. Maybe you want to look at how that works and, you know, give them some advice. But most parents, I'd say probably 95% of parents, I think, are probably doing a pretty good job and really doing the best they can. And I've talked with other psychologists, and of course, you know, oftentimes we feel as psychologists, our children are the least well-adjusted. And in French, there's an expression about how the shoemaker's shoes don't fit. And, you know, it's not true that psychologists have more maladjusted children than other people. It's just the expectation is our children should be perfectly well adjusted. And in my case, that's not the case. They're like any other children. They've had their problems. And I was talking to a good friend of mine and a colleague and another co-author about this. And we were talking about how, as a parent, you do the best you can. You really try very hard, but you also are willing to pay for the psychotherapy for whatever you didn't do well.
We talked about procrastination, about perfectionism, but there is another interesting topic regarding the imposter syndrome. This kind of people feel uncomfortable when one sincerely congratulates him or her. And why is that? Could be the case that the person has a low self-esteem, for instance.
Absolutely. And I'm gonna question the term self-esteem. It's not one of my favorite psychological terms. It was invented in the 60s to help us understand how we feel about ourselves. But you know, this is 50 years ago, and psychology hadn't advanced to the point it has now. And when you ask somebody how they feel about themselves, depending on the day, depending on what just happened, depending on their physical state, you'll get a different answer. Self-esteem is a very unstable concept because it is based on our performance. So you get into a vicious circle. If I perform well,
it's not a trait, it's merely, I don't know, a punctuate characteristic.
It's a measure. It's a measure. We can measure self-esteem in the same way we can measure state anxiety or low levels of depression. It's just how we feel at a certain time. It's a snapshot. So self-esteem isn't a great measure. One of the articles I wrote a long time ago with one of my colleagues at the university, we measured how stable self-esteem was, and we discovered it wasn't, because it's based on performance. So inside us, we say, oh, if I do well, I'm great. If I do better, I'm even better. And the converse of that is, oh, if I do badly, I'm lousy. And if I do really badly, I'm a loser. So we can't do that. Really negative thing to do. Many years ago, Albert Ellis, who is one of the founders of cognitive behavioral psychology, proposed the term unconditional self and other acceptance. And the idea behind unconditional acceptance is that we accept the hypothesis that we're human and that being human will make mistakes, that some days we'll do well and some days we'll do less well. And we can accept ourselves regardless. And actually, if you look at the modern approaches in psychology, notably acceptation and commitment therapy, we look at acceptation of even outside situations and other people, because the objective is to say that is what it is. And having negative emotions doesn't make it better or worse. So when you move towards a feeling of self-acceptance, you approach your objectives and you say, you know, once they're done, you say, oh, well, you know, that article is written. I wish I'd done this differently, but it feels good to have it done. And I'm going to move on to the next one and I'll have learned something from that. Or when you do something, the trick is you have to do it in both directions. If you manage to do something really well, if you handle a situation very well, you go through that and say, oh, that felt good to handle that so well. But in both cases, you're not amazing because you handled the situation well, or loser because you wrote a bad article. So we move towards this notion of self-acceptance because in the long run, it serves patients and individuals much more. It's very hard though, because all of our education from very small up to, you know, the day we die is based on our performance. People will give us good feedback for our performance. They rarely give us feedback on us as individuals. So we have to kind of develop that in ourselves.
And this is the way perhaps you work with people who think I do not deserve any prizes, any congratulations at all.
Absolutely. And one of the other tools that we've used in this is some tools using auto-compassion or self-compassion. Christine Neff's written a lot about this, as has Christophe Germier. And this notion of self-compassion really helps people to start being nice to themselves. Because there again, we're not taught from a small age how to be nice to ourselves. We're not given any sense of how we can be accepting of ourselves. And one of the things parents can do is to try and take the focus off of results. For example, if a child draws a picture, the response should be, oh, it must have been fun to draw that, not, oh, that's a really good picture of a horse. Same thing with a good grade. When a child gets a good grade, a response has to be, that must be a relief. All that work that you did, that must feel good to have a good grade today. And when they get a bad grade, oh, that must feel awful. Is there anything I can do to help you feel better about yourself? And not, because if we bring it to them as being an equivalent of who they are as people, they'll integrate that and use it. And no matter how hard we try, teachers will still say, oh, you're a great student, which is a role they have. It doesn't mean they're a great person. They may be a great student, but they might be lousy at basketball, you know? So you have to remember, we have different hats too. I'm really pretty good at teaching. I'm not very good at cooking big dinners anymore. You know, it's just, you understand what your skills are and you go with them, you accept them. And so, yes, it is one of the basic tools we will shoot for in psychology. We wrote quite a bit in the book about self-acceptance, and it, no matter what we do, it's really a basic element for good mental health.
I see. And one final question: apart from therapists and psychologists, who else could learn from your book, Traiter la dépréciation de soi? Who could, I don't know, use the technique and the tools you are describing in your book?
I think anybody who's working with other people, particularly in management situations, it's really useful for people in human resources to look at what's going on in their teams and start seeing that maybe somebody who's burnt out is burnt out because they're working too hard, and they're working too hard because they're perfectionistic and they procrastinated. These sorts of people can be really helpful. Anybody who's working, you know, even people in different professions where they have a group underneath them to understand that this might be going on. And for example, imagine a doctor who's running a large service of different people that they work with. I think we have to understand that people often don't feel like they deserve the place they have. And a couple of tools you can have is accepting other people, using these sorts of explanations that I said, like, for example, if somebody does something not well, say, oh, you know, what you've done is not up to what I expected, but it has some really good qualities. Let's see how we can fix this, you know, move towards a solution-based focus and use a lot of self-acceptance and model it and other acceptance. You know, you're great, you have these other qualities. And the most important one, and this one, I was talking with a friend about this earlier today, is reinforcement and kindness. Is every now and then spontaneously reminding people how valuable they are. This is just essential. And even on a day-to-day basis as human beings, for example, during the pandemic when things were closed down, something I used to say when I went into grocery stores is I'd thank the cashiers for being there. Because it's not easy to go in and work in a situation where they might be infected with a virus. And they were always surprised and they'd say thank you. And I think recognizing how everybody can impact us, there's a person who cleans in front of my house and I thanked him profusely because nobody cleans in front of my house. And he was just so surprised, and now he always cleans in front of my house. I didn't do it, so he would do that. But it feels good to be recognized for doing something like that. And I've had students write me letters at the end of the year and I keep them because we get a lot of flack as professors about, oh, you graded me too hard on that, or, oh, we have so many papers we have to do, you to understand. And then to have a student say, oh, it was so nice being in your class because you were so understanding and helpful. It's like, I got to keep that information. And we all have to keep those bits of information for us. So that would be my suggestion. It's everywhere.
Thank you, Professor Callahan, for your precious advice and explanations on imposter syndrome, a topic which more and more people are interested in, even in Romania. And of course, thank you for your book, co-written with Kevin Chassongre, entitled Traité la dépréciation de soi, le syndrome de l'imposteur, translated in Romanian as Sindromul impostorului. Thank you a lot. Thanks a lot.
Thank you so much for taking the time with me today.